What is Epic and how can it help you pay for Part D prescription costs? Epic is a New York State program that works with Medicare and they work together to reduce your costs for prescription drugs. What is Epic? The Elderly Pharmaceutical Insurance Coverage. That's the acronym for EPIC. Program is a New York State program for seniors administered by the Department of Health. It helps more than 250,000 income eligible seniors age 65 and older to supplement their out of pocket Medicare Part D drug plan costs. Seniors can apply for EPIC at any time of the year and must be enrolled or eligible to be enrolled in a Medicare Part D drug plan to receive EPIC benefits and maintain coverage. This is a great program if you qualify. EPIC provides secondary coverage for Medicare Part D and EPIC covered drugs purchased after any Medicare Part D deductible is met. EPIC also covers approved Part D excluded drugs once a member is enrolled in Part D. So what this means, if you have a zero deductible, you're automatically covered with the EPIC program. EPIC helps pay the Medicare Part D drug plan premiums for members with income up to $23,000 if single or $29,000 if married. Higher income members are required to pay their own Part D premium, but EPIC provides premium assistance by lowering their EPIC deductible. EPIC has two plans based on income. The free plan is for members with income up to $20,000 if single or $26,000 if married, and the second plan, which is the deductible plan, is for members with income ranging from $20,001 to $75,000 if single or $26,001 to $100,000 if married. So that's quite a spread for a married couple or a family with children. That's quite high. It is easy to join the program. Just complete the application and mail or fax it to EPIC. No documentation is required because EPIC verifies information with the Social Security Administration and the New York State Department of Taxation and Finance. So what they do, they have access to your tax return and they can see exactly what you're reporting as your income. EPIC eligibility requirements. To join EPIC, a senior, because remember this is only for people over 65, must be a New York State resident age 65 or older, have an annual income below 75,000 if single or 100,000 if married, be enrolled or eligible to be enrolled in a Medicare Part D plan, no exceptions, and not receiving full Medicaid benefits. Remember, this is if you have Medicaid, you already have a benefit. Note, you can join EPIC at any time during the year. Once enrolled, you will receive a special enrollment period to join the Medicare Plan Part D plan. You are not eligible to receive EPIC benefits until you are enrolled in a Part D drug plan. So you have to join the Part D plan. Seniors who are not eligible to join the Medicare Part D drug plan cannot join EPIC. Example, seniors with a union retired drug subsidy program that is not a Part D plan, seniors without Medicare Part A or Medicare Part B. Seniors with Medicare Advantage or an HMO health assistance can only join EPIC if they have a drug plan coverage uh, with their HMO. So again, seniors with Medicare coverage HMO health insurance can only join EPIC if they have Part D drug coverage with the HMO because some HMOs do not provide drug coverage. Residency. To enroll in EPIC, you must be a resident of New York State. This means that your permanent home, not a summer or winter home, is located in New York State. It also means you live in the state on a regular, ongoing basis, and New York State address is listed as your home address on official and legal documents. You need to notify EPIC whenever you change your address. Now, if you live in another state, California, West Virginia, anywhere in the country, they probably have a program similar to EPIC in your state. Income. For purposes of EPIC enrollment, household gross income is the previous year's total annual income of the senior or married spouses. Now, what this is saying is if it's, let's say today is February 21st, and you haven't filed this past year's income tax, they go to the prior year, when you did file, because that's how they know what kind of income you have. So the the this is includes but not limited to federal adjusted gross household income as reported on your tax return, federal Social Security payments less Medicare premiums, railroad retirement benefits, the taxable amount of IRA distributions and retirement annuities, the support money, including foster care support payments, excuse me, supplemental security income, tax exempt interest, workman's compensation, gross amount of loss of time insurance, cash public assistance and relief other than medical assistance for the needy, non taxable strike benefits, veterans disability pensions, and lottery winnings. So it encompasses basically everything you earn. It does not include food stamps, Medicare premiums, as mentioned above, Medicaid, scholarships, grants, surplus food, payments made to veterans under the Federal Veterans Dioxin and Radiation Exposure Compensation Standards Act, which was Agent Orange. Epic Free Plan is the first plan, and the plan is for members with income up to $20,000 if single or $26,000 if married. Members pay an annual fee to Epic ranging from $8 to $300 based on their prior year's income tax. This fee is based in quarterly installments or can be paid annually after any Part D deductible is met if the member has one. Fee plan members only pay the Epic copayment for drugs. Co-payments range from $3 to $20 based on the drug costs not covered by Part D. EPIC identification card is mailed to the member upon successful enrollment. This card is issued once and should be kept and used for subsequent years. The coverage year runs through December 31st each year, so it's a calendar year. EPIC pays the Medicare Part D premiums up to $37.23 per month in 2014, and it's basically whatever it is in 2015 for members in the fee plan. Because all Medicare plans basically are standardized. So the the standardized premium is about $37, and they'll pay up to that amount. You pay the difference. This is how Epic works for plea plan members. Show both your Medicare Part D drug plan and Epic ID cards when you go to the pharmacy to purchase your drugs. Your Medicare Part D drug plan is your primary drug coverage, and you must make enrollment in a Part D drug plan to receive Epic benefits. Epic provides secondary coverage for Medicare Part D and Epic covered drugs after you meet your Medicare Part D deductible if you have one. Once enrolled in a Medicare Part D drug plan, Epic also covers approved Medicare Part D excluded drugs such as prescription vitamins and prescription cough and cold preparations. Not over the counter, prescription. You will only pay the Epic copayment ranging from $3 to $20 based on the cost of your drug. If you have full extra help low income subsidy, LIS, from Medicare, you will not be required to pay an Epic fees and your co-payments will be lower. So that extra help low income subsidy is also an important part of this. Epic deductible plan. This is the second plan for the higher income. The deductible plans for members with income ranging from $20,001 to $75,000 if single, or $26,001 to $100,000 if married. Members must meet an annual Epic deductible based on their prior year's income before they pay Epic co-payments for drugs. An Epic identification card is mailed to the member upon successful enrollment. This card is issued once and should be kept and used for subsequent years. The coverage year runs through December 31st each year, calendar year. Epic pays the Medicare Part D plan premiums up to $37.23 in 2014 or whatever the current rate is in 2015 for members in the deductible plan with incomes ranging from $20,001 to $23,000 if single or $26,001 to $29,000 if married. Deductible plan members with incomes between $23,001 to $75,000 if single and $29,100 if married are required to pay their Medicare Part D premium each month. To provide Part D premium assistance, the Epic deductible shown on the deductible plan schedule is further reduced by $447 per year, the annual cost of a basic Medicare Part D drug plan. And what this means is they do give you an extra benefit of reducing the premium. This is how Epic works for deductible members. Show both your Medicare Part D drug plan and Epic ID cards when you go to the pharmacy to purchase your drugs. Your Part D drug plan is your primary drug coverage, and you must maintain enrollment in a Part D drug plan in order to receive Epic benefits. Epic provides secondary coverage for Medicare Part D, and Epic covers drugs after you meet your Medicare Part D deductible if you have one. Once enrolled in a Part D drug plan, Epic also covers approved Part D excluded drugs such as prescription vitamins and prescription and cough preparations, because some of that is not covered by Medicare. After you meet any Part D deductible, if you have one, out-of-pocket costs for covered Part D and Epic medication will be applied to your Epic deductible. What they're saying here is, I have plans that I offer that have no deductible for the Part D plan. Once you are enrolled in Part D drug plan, drug costs for approved Part D excluded drugs will be applied to your Epic deductible. After you meet your Epic deductible, you will only pay the active co-payments ranging from $3 to $20 based on the cost of your drug.